first I'm going to check the doctor's orders to insert a Foley catheter. I'm checking for allergies to latex, adhesive, betadine, and then I'm going to gather my supplies. I have my supplies here, and then I'm going to also check for if I need any assistance. Normally, if it's a female patient, I would have another female nurse come in and do the Foley with me. And then, so I'm going to go ahead and come in. So I'm going to knock. Hello, my name is John. I'll be your nurse for today. I'm going to provide for privacy. I'm going to perform hand hygiene. And then I'm going to verify the patient's first and last name and date of birth. Thank you. And then I'm going to go ahead and tell the patient that I'm going to insert a Foley because she's going to go to surgery later. So I'm going to insert a Foley catheter into your urethra, and I'm going to drain out the urine. And then I'm going to get the bed ready. I'm going to put it to a working height. I'm checking the wrist for any allergy bands. I'm asking the patient, are you having any pain? Can you rate your pain from 0 to 10? 0 being no pain, 10 being the worst pain that they're having in life. So the patient's having no pain. So I'm going to go ahead and that's up to the working height. And then I'm going to go ahead and set up the bed. And I'm going to expose the patient into there. And then I'm going to perform hand hygiene, wash my hands, and then get some work done. And first I'm going to start off is I'm going to do some pericare on the patient. I got some wipes, and then I'm just going to go ahead and wipe down. Another one. Down. Okay, so now that I've cleaned up the patient, I'm going to have the patient position herself in a dorsal recumbent position. I'm just going to have her come in. Do that, and then I'm going to, I would have a chuck. I'm just going to go ahead and grab this one, but I'm going to remove my gloves, scrub the wipes, perform hand hygiene. Okay. And then I'm going to go ahead and set up my table. I'm going to just have it right here. And then I would clean my table with some wipes. And then I'm going to have my Foley catheter kit. Okay, so I'm going to go ahead and get started. Over here. Okay, alright, so I got that open. And then I'm going to go ahead and grab this. Place up there. Place them there, and I'm still have the patient in my sight here. Open this up, and I'm going to mind my 1-inch borders. Then I'm going to go ahead and grab my right glove first, and can still see the patient up and away above my waist, below my neck. And I'm going to go ahead and grab this other one. And it's up and away. And then I'm just going to go ahead and fix it. Okay, and then I'm just going to go ahead and move the table with my feet away from me. Okay. And then, so What I'll do next is, I'm not gonna use this, so I'm just gonna go ahead and toss that over there. I'll set up my tray. And then I'm mining the 1-inch border on there as well. Okay, and then I would open up my betadine and then pour it on the cotton balls. I'd open up my lube and I place it here. And the next thing that I'm gonna do is I'm gonna grab my syringe here, and then I have 10 cc's. I'm gonna go ahead and take off the cap, insert, and place that down, and then I'm gonna remove the plastic from the catheter. Then what I like to do is I'll place it in the, I would normally place it in the lube, but since I didn't actually do it, I'm gonna leave it here. And this, I'm just gonna toss. And then, so now what I'm gonna do is I'm gonna become one-handed. So I'm gonna use this hand to open up the labia minora. So I'm gonna go ahead and open it up. And I'm gonna grab the tongs here. And the cotton ball soaked in betadine. I'm gonna start on the patient's left side. I'm gonna go down, drop. I'm gonna go on the other patient's side, on the right side, down, drop. And then the last one I'm gonna use down the middle. So down, drop. Put it there. And then next thing I'm gonna do is I'm gonna grab my catheter here. I'm gonna grab it 2 inches away from the end. And then what I'm gonna do is I'm gonna loop it, and then I'm gonna dip it in the loop, 2 inches in. I'm gonna go ahead and grab this here. I'm gonna place it inside the urethra, top here. It's hard to do it without lube, but and then I would keep inserting until I see a flash of urine. And then once I see the flash of urine, I'm gonna go ahead and go another 2 inches in. And then once I'm done there, I'm gonna hold with this hand. And then with this hand over here, I'm gonna go ahead and insert the water. I couldn't go all the way in because I don't have any lube, so I'm just gonna pretend I pushed it all the way in. And then I would hold pressure on the plunger, and then I would release here, and I would hold here, holding pressure on the plunger, and I would remove, and I drop that there, and then, so now I'm not sterile anymore, I'm just clean. So I'm gonna remove these gloves, because I was touching the patient's vagina. Perform hand hygiene, put on new gloves. My hands are sweating. Come on. Oh my gosh. Okay, and then I'm going to perform pericare or clean off the betadine from the patient with the wipes. Dropping there, wiping, dropping it, dropping it there. So then I'm gonna go ahead and clean up my stuff. I'm gonna move this over on the patient's side. Then I'm gonna clean all this up. I'm gonna throw this in the trash right here. But I'm not gonna throw it away because I'm gonna reuse this possibly. So I put it here. And then I remove my gloves. Perform hand hygiene, and then I'm gonna put on another pair of gloves. And then I cleanse the skin here with the I don't have the, well, I cleanse the skin, then I'm just gonna use tape. So I cleanse the skin, and then I would tape this here to the patient, and then I'm gonna pass this underneath, making sure it's underneath the bladder. And then I tuck it down here into the bed. Get down here to the bed, and then have some tape. Oh, so I have some tape here, and I made sure the patient had no allergies to adhesive tape. Of course, I can get the tape up. Oh my gosh, this tape is not working. Perform hand hygiene. So tape it. And then I would want to hook this to the bed, this part here, actually first. So I'll hook this to the sheet so it doesn't move, and make sure that it's not folded over here. Okay, and then I tape here. I normally would have one of those locking mechanisms, but I'm just going to tape it just to show it for this go. Okay, and then I'm going to go ahead and help the patient back to cover them up. Okay, and get this trash out too. Alright, and then I'm going to go ahead and lower the bed. So how was that? How was it? Were you able to tolerate that? Was that okay? Are you having any pain? So reassessing the pain. Patient's doing well. Lowering the bed. So I have your call light here. Go ahead, and if you need anything else, go ahead and press this button. We'll come right in. If you have any other needs or concerns right now, so patient's okay right now. Putting the bed down. Rails are up. And then it's done. Then I'm going to go ahead and wash my hands, provide for privacy, and then I'm going to document that I inserted a 14 French Foley. Patient tolerated it well. I used 10 cc's of the sterile water for the balloon, and the patient's doing well.